Hi everybody, my name is Dr Nokukhanya Khanyile and I'm so glad that EWN has asked me to do this. I'm very glad that, I'm able to share my experience as a medical professional working during a lockdown period like this. Because I think a lot of people assume that we're just going to work as normal, but it's actually not the same like it was before. Obviously, we still are expected in the government sector to work a mandatory minimum of 240 hours a month. So that's 160 normal working hours with an extra 80 hours of overtime. But I think, even though that's what some people have in other areas because of shortages, I've heard some staff working more than that. I'm working at the Rahima Musa Mother and Child Hospital currently, and so we're not really exposed to COVID as such high-risk patients as people who are in areas where they have emergency casualties that see adult patients. But right now, my emotional state is really one of just trying to keep myself upbeat, trying to keep myself happy. I'm really a bit worried because I think for me, when COVID, first came out and I started hearing about what was going on with the healthcare system in Italy and how Spain had to, resuscitate people in parking lots, they had to open new, ICUs in whatever space they had available. I was really a bit scared about that because South Africa, our healthcare system is so overburdened. We already are, triaging patients for ICU. We already say, you do or don't get a bed because of your risk and your prognosis, basically. So for us to know that a situation like COVID was coming, just to have that extra burden of having to triage more people for a condition that is really preventable if people just do the right thing, was giving us a lot of anxiety. And we've been running drills at work. People have been screened at work. There was a bit of a scare where I had done a talk at WITS, and one of the students who had become positive was at the talk and we didn't know who it was, so I actually had to isolate for 3 days at home while we waited for my test results. Thank the Lord they were negative, but just the fact that I was out of the healthcare sector for that much time, you're losing a skill of someone. That also just made me think, if we have a patient that comes into our ICU who is positive or even a suspected case, and we have to then lose staff members because of that, because they have to isolate, because they have to self-quarantine, that really puts a strain on just my mind, because how we're gonna deal with that. One thing I really urge people to do, so please stay at home. I understand that, cabin fever may be starting to set in. Please just try to remember at the end of the day that we're trying to flatten the curve. And what that means is we're trying to give ourselves time, firstly, to be able to handle the workload and the number of people that are affected, which means coming into contact with people who have COVID-19, and also infected, which means people who actually have positive tests. The South African health system won't be able to survive a COVID outbreak. The second thing is to remember that by staying home, you are actually on the front line of this illness. We are the last defense. If patients come to the hospital and they're already positive, they've come into so much contact with other people that we are the last defense. If we get ill or if we get exposed, there's nothing left after us. And we don't have a choice sometimes in some situations to not come to work because there's so little of us already. So we're doing our best. So if you can remember that you staying home is actually like contributing to us flattening the curve, it helps by time to get a vaccine, because then we are able to protect the people who have weakened immune systems, protect the elderly, protect people who can't fight this virus. We just have to put into basic practice our hand washing practices. I mean, we should know that by now, but it's so weird because so many people are making such a big deal of hand sanitizer and hand washing. Like, what were you doing before? But in summary, I'm really glad and I'm really thankful that our government has really jumped on this so quickly. The fact that they made such a quick decision is just indicative, one, of how severe this outbreak is, two, the potential disaster that it has, and three, they understand the burden on the health system already, because coronavirus is just the one condition. We still have people with other things like strokes, heart attacks. So we don't stop medicine just because of coronavirus. So you staying at home is really helping us. Otherwise, I think our spirits are high. I'm trying to keep myself as well as the team motivated and just maintaining the same standard of work. We're trying to push, we're trying to make sure that everything gets done with excellence, that we don't miss things, because we want to make sure that our current workload is done properly, so that if we have to increase the workload, we are successful. And I just want to thank you, South Africa, for staying home. Thank you for washing your hands, sanitizing your hands, and making sure that you're protecting your fellow South Africans. So have a great one, and yeah, just be blessed.
For more, go to ewn.co.za.